Okay, good evening. Welcome po sa Panlasang Pinoy. Ang lulutuin natin ngayon ay, joke lang ulit. We will be discussing about mixing studies. So, mixing studies are a series of tests where you find out a missing coagulation factor. So, we will discuss what actually happens in the laboratory, and syempre, ang pinaka-confusing part, okay, is the analyzation, kung paano or how to identify, how to find out that missing factor. Okay, so first off is you collect a blood, malamang ay citrated blood, which will produce a plasma. Then, this plasma will be then tested with PT and APTT. So kasama ang thrombin time pero naka-broken line siya kasi not all the time, okay? So usually ang ginagamit lang for mixing studies is PT and APTT. So review tayo ng konti, okay? Review tayo ng konti na yung PT, it is a test to detect missing coagulation factors that belong sa extrinsic extrinsic pathway, and also from the common pathway. Okay, so again, your PT is a test used to detect missing coagulation factor from the extrinsic pathway or common pathway. Next is your APTT. The APTT is it is a test that detects missing or deficient coagulation factor that belongs to the intrinsic pathway and also common pathway. Okay, the thrombin time naman, kung dadagdag natin, thrombin time detects factor 1 deficiency. Okay, so review. PT is a test which detects deficiency of clotting factors or coagulation factors from the extrinsic pathway and common pathway. And your APTT is a test where it detects missing coagulation or clotting factors that belong to the intrinsic pathway and common pathway. And your thrombin time detects factor 1 deficiency. So, time out muna tayo. Let us review first the different types of pathways. Okay? So, kung naalala pa ang coagulation cascade, ito ang mga pathways natin. So, first is your intrinsic pathway. Your intrinsic pathway includes factor 12, factor 11, factor 9, and factor 8. Okay? So, hindi ko na sinama si prekallikrein and high molecular weight kininogen kasi their absence or their pag deficient sila, they are not detected using the mixing studies. And of course, there are other tests for those types of factors. And also, ang mga si high molecular weight kininogen and si prekallikrein na once deficient sila, minor abnormalities lang yung kinokos nila. Okay? So, importante yung apat na yan. Next is si extrinsic pathway. The extrinsic pathway includes your factor 7. So, malamang hindi ko na in-include si factor 3 or tissue factor because our body is made up of complex of different types of tissues. And this tissues will produce factor 3. Kumbaga, sa madaling salita, hindi ka mauubusan ng factor 3. Okay? So, next is the common pathway. The common pathway includes factor 10, factor 5, 10, 5, 2, and 1. Okay? So, huwag niyong kakalimutan kung ano yung mga clotting factors or coagulation factors na nasa pathway or specific pathway na yan. Okay? So, balik tayo dito. So, ang sabi natin kanina, the patient's plasma will be tested with PT and APTT and sometimes thrombin time. Okay? So, tingnan natin yung results. Okay? So, if the PT is prolonged and the APTT is normal, okay, ang ibig sabihin nun, yung missing factor natin is nasa extrinsic pathway. Okay? If the PT is prolonged or abnormal and the APTT is normal, our missing factor belongs to the extrinsic pathway. If the PT is normal and the APTT is prolonged or abnormal, meaning our missing factor belongs to the intrinsic pathway. Okay? Next, if the PT is prolonged and the APTT is also prolonged, then our missing factor belongs to the common pathway. Ganun lang. Okay? So, wag niyong kakalimutan yan. Okay? Result ng PT and APTT, kung extrinsic pathway ba or intrinsic. So, ayan, wag niyong kakalimutan yan. Okay, so that is the first step. The next step is, itong patient's plasma na to, we will aliquot. Okay, i-aliquot yan. I-divide yan into 5 tubes. So, ito na yung next step. I-divide into 5 tubes. 1, 2, 3, 4, 5. Or, it depends kung ilang tubes or ilang samples yung gagamitin nyo. And also, it will depend kung ilang reagents ang gagamitin nyo. The reagents used for mixing studies is the fresh plasma, the aged plasma, the adsorbed plasma, fresh serum, and aged serum. The most commonly used reagent for mixing studies is the fresh plasma, the adsorbed plasma, and the aged serum. So, minsan itong aged plasma and fresh serum, ginagamit din naman sila, but not all the time. Pero pwede siyang ilagay or ibigay as given during exams or quiz. So, at least, isama niyo na sa study niyo, ingat kayo, 'di ba? Para magamit niyo din. So, isa-isahin muna natin yung mga reagents na to. Okay? Okay, so fresh plasma. The fresh plasma contains all clotting factors. Okay? Huwag niyong kakalimutan 'yan. The fresh plasma contains all clotting factors. Next, the aged plasma. The aged plasma contains all clotting factors except factor 5 and factor 8. Okay? So, huwag niyong kakalimutan na factor 5 and factor 8 are one of the labile coagulation factors. So, kung after a while, if magtatagal or if the specimen is left unprocessed for more than 2 hours, mawawala na yung factor 5 and factor 8. So, ganun lang. Next is the adsorbed plasma. Okay? Yung adsorbed plasma, once the plasma is treated with barium sulfate and aluminum hydroxide, okay, yung vitamin K dependent factors, coagulation factors will be lost. Okay, so the adsorbed plasma contains all coagulation factors except factor 2, 7, 9, and 10. Shortcut is 1972. Okay, so next is the fresh serum. Ito ang fresh serum. The fresh serum contains all clotting factors except factor 1, less than 20% factor 2, factor 5, factor 8, and factor 13. Okay? So, next, the aged serum naman. Ang aged serum, it contains all clotting factors except factor 1, factor 2, factor 5, factor 8, and factor 13. Okay? So, ang gagawin next is, so ayun, na-discuss na po natin yung mga different types of reagents used for mixing studies. So, again, the next step, balik tayo dito. Kung sino man yung nag-abnormal, kung PT man o APTT, di ba? So, yung patient's plasma will be distributed into 5 tubes or pwedeng 3 tubes lang or depende kung ano yung, or kung ilan yung gagamitin nyo. So, ngayon, ang patient's, one part of patient's plasma will be mixed with fresh plasma. Mix talaga guys, as in ipaghahalo talaga siya. Kaya nga tawag sa method na to is mixing studies kasi imi-mix, okay? So, ito, patient's plasma will be mixed with fresh plasma and so on. Patient's plasma will be mixed with aged plasma, ayun, okay? So, gets niyo na yun. So, after mixing the patient's plasma with a reagent plasma, itetest ulit yan. Okay, itetest ulit yan sa PT or APTT or both. Okay? Ngayon, whatever the result will be sa bagong PT and APTT test, okay, i-compare ang result na to dun sa previous result natin dito sa unang test natin, okay? So, ang result neto tsaka ang result neto i-compare natin. Okay? So, doon na natin malalaman if corrected or not corrected. Okay? Doon natin malalaman kung corrected or not corrected. So, again, the result of our first test here, okay, PT and APTT, will be compared sa second test natin dito. Anong difference nila? Ang first test natin, it only contains the original patient's plasma. Wala pang nakahalo, di ba? At dito naman, sa next test natin, sa second natin na PT or APTT or both, ito na yung gumamit tayo ng patient's plasma plus the reagents, okay? So, after we compare, doon na natin malalaman kung corrected or not corrected. So, let me explain ano ba yung corrected or not corrected or correction or without correction. So, ito. Example, this is the patient's plasma. And ito yung wala siyang factor 5, okay? The patient's plasma doesn't have any factor 5. Factor 5 yan ha, factor 5. Wala siyang factor 5. Ngayon, ang patient's plasma, dinagdagan mo ng reagent plasma. Let's say, fresh plasma. So, patient's plasma plus fresh plasma, then you test with PT or APTT, the result will be corrected. Bakit corrected? Kasi, eto, ang patient's plasma, wala siyang factor 5. Pero, yung fresh plasma na ginamit natin, meron siyang factor 5 because, kakadiscuss lang natin kanina, the fresh plasma contains all clotting factors. So sana na-gets nyo, di ba? Again, ang patient's plasma, if imimix mo siya sa reagent's plasma, which is, ang sabi natin kanina, fresh plasma, so, tinest mo ulit sa PT and APTT, malamang makokorek talaga. Kasi, di ba, pag mix mo, wala siyang factor 5, pero nung minix mo sa fresh plasma, may factor 5 na siya. Okay? So, ganun pa rin. Patient's plasma, wala siyang factor 5, minix mo siya sa age plasma. Kaso, the age plasma doesn't contain any factor 5. So, ang result niyan will be not corrected. Kasi, yung age plasma, wala na siyang factor 5 eh. Diba? So, ganun lang. Sundan lang natin. Patient's plasma, wala siyang factor 5. Okay? So, minix mo siya sa adsorbed plasma. Ang adsorbed plasma, ang result natin dyan pag tested with PT or APTT will be corrected. Bakit corrected? Kasi ang wala lang naman na factor sa adsorbed plasma is factor 2, 7, 9, and 10. Diba? Okay, so next reagent will be fresh serum and age serum. Both fresh serum and age serum, wala silang factor 5. So pag minag-mix mo ang patient's plasma with a fresh serum, ang mangyari doon, not corrected. Kasi, fresh serum na siya eh. Wala siyang factor 5. Okay? Next, ang patient's plasma, pag minix mo siya sa age plasma, patient's plasma is, na-mix mo siya sa age serum, not corrected pa rin yun. Bakit not corrected? Kasi, yung age serum, wala na siyang factor 5, diba? Wala na tong factor 5, tapos wala din tong factor 5. So, pag pinag-mix mo, hindi talaga mako-correct yun. Okay? So, ganun lang po. So, ganun lang ang preparation natin for mixing studies. Okay? So, again, let's recap natin. First is you perform PT and APTT. So, whatever will be the result, ito yung mga possible result natin. Ito yung possible 1, 2, 3. So, whatever or whichever is the result dyan, okay, ang next na gagawin is the mixing part. Then, after the mixing part, perform PT and APTT. So, once you perform PT and APTT na, you compare the result of this step, okay, of this PT and APTT na to, from your previous PT and APTT test. After comparing, malalaman mo na, okay, kung nasaan yung corrected or not corrected. Paano ba malalaman? Prolong. Normal. Diba? Meaning kasi ng prolong, meaning na prolong yung time Kasi may deficient or may missing na coagulation factors. Okay? So, ayan po yung sa laboratory part. Now, let's proceed sa analyzation part. The analyzation part is medyo tricky, medyo complicated, but kaya natin yan. Just remember the rules, okay? Again, remember lang yan. Remember niyo yung test kung para saan si PT and APTT. Okay? Remember niyo din yung mga presence na factors sa different types of reagents. And also, remember yung mga specific coagulation factors na involved sa specific pathway. Okay, so ilalabas ko na yung prepared ko na problem. So, number 1. Excuse me. Okay, so number 1. Number 1, your PT is prolonged and APTT is normal. So, analyze natin ng konti. PT prolong, APTT normal. So, dahil hindi naman sila parehas na prolong, meaning yung missing factor natin wala sa common pathway. Okay? So, lahat ng coagulation factors natin sa common pathway is present. Okay? Nandyan, hindi missing. Next, dahil APTT is normal, meaning lahat ng coagulation factors natin that belongs to the intrinsic pathway is also present, hindi siya missing, okay? So, ngayon, ang PT natin siya yung prolong. At dahil prolong siya and your PT is a test to detect coagulation factors that belongs to the extrinsic pathway and common pathway, so our best answer dyan sa choices is si factor 7. Okay? So, hindi pwedeng factor 10. Bakit hindi pwede ang factor 10? Kasi, factor 10 belongs to the common pathway. Hindi rin pwede ang factor 9. Factor 9 belongs to the intrinsic pathway, di ba? And, factor 5, hindi pwede si factor 5 kasi nasa common pathway din siya. Remember, kung titignan mo yung given sa number 1, ang missing factor natin, makikita na natin agad na nasa extrinsic pathway siya. Okay? So, next, number 2. Ayan po yung number 2. PT is normal and APTT is prolonged. So, if your PT is normal, it means that extrinsic pathway na coagulation factors are normal, meaning nandyan sila or present. But, your APTT is prolonged, meaning meron tayong missing coagulation factor na belong sa intrinsic pathway. Okay? So, ang next step na gagawin nun is ihahalo na sila dun sa mga reagents. Okay? So, when the APTT is mixed with normal plasma, ang binigay na result is corrected. When the APTT, yung APTT pinerform, minix sa adsorbed plasma, not corrected. Not corrected. Next, APTT pinerform gamit ang age serum. Okay? Minix na ang age serum tsaka yung patient's plasma. Corrected siya. So, ayan na yung mga given natin. Okay? So, APTT plus normal plasma, corrected siya. Bakit corrected siya? Kasi, diniscuss natin kanina na fresh plasma contains all coagulation factors. Okay? Normal or fresh plasma, parehas lang yon. It contains all coagulation factors. Kaya mako-correct talaga yan. Sa adsorbed plasma naman, not corrected siya, di ba? Kasi ang wala sa adsorbed plasma is si factor 2, factor 7, factor 9, and factor 10. Okay? Ayan yung mga wala. So, dahil not corrected siya, meaning may idea na tayo na isa dito sa 4 yung missing coagulation factor natin. Kasi 'di ba, yung patient wala siyang ganung factor, tapos nung inad na ng or dinagdagan mo ng adsorbed plasma, not corrected. So, nandito. Okay, isa sa 4 na to ang missing factor natin. Ngayon, next is the APTT. Yung APTT pinerform ulit na yung gamit is patient's plasma na with age serum, na-correct na siya. Bakit na-correct siya? Kasi, kung titignan natin yung second result, diba, Itong mga to, itong apat na to, present naman siya sa age serum. Diba? Maliban sa factor 2. Okay? So, mamaya discuss natin yan mamaya. So, ngayon isa-isahin natin. Okay? May idea na tayo based sa adsorbed plasma. Not corrected siya eh. Okay? Dahil not corrected siya, ito na yung apat. Ngayon, hindi pwedeng factor 10 yung missing factor. Bakit? Kasi factor 10 belongs to the common pathway. So, hindi pwedeng si factor 10. Ba? Hindi pwedeng si factor 10. Ngayon, hindi naman pwedeng si factor 2. Kasi si factor 2, it also belongs to the common pathway. Okay? Ngayon, hindi rin pwedeng si factor 7. Kasi si factor 7, it belongs to the extrinsic pathway. Ba? Titingnan pa lang natin dito, normal PT normal. So dapat si factor 7 is normal. So most likely or our missing factor is factor 9. Tama ba? Kasi kung titingnan mo number 2, PT is normal, APTT is prolonged, so meaning nasa intrinsic pathway yung missing coagulation factor natin. Si factor 9 ba? Si factor 9 ba nasa intrinsic pathway? Yes, tama. So, our missing factor is factor 9. Okay, next, number 3. So, both PT and APTT are prolonged and the thrombin time is normal. So, if both PT and APTT are prolonged, it only means that the missing factor belongs to the common pathway. Okay, so it belongs to the common pathway. So the given here is fresh or normal plasma. It is corrected. Why? Because syempre, fresh or normal plasma, it contains all coagulation factors. So malamang corrected talaga yan or may correction talaga yan. Okay? So next is the age plasma. In the age plasma or it is not corrected. So dahil not corrected yan, dalawa lang yung possible na missing factors natin dyan. Pwedeng si factor 5 or si factor 8. Okay? So sa adsorbed plasma, it is corrected. So meaning yung missing factor natin wala dun sa mga na-adsorb na coagulation factors. So wala, hindi si 1972. Okay? So next is fresh serum. The fresh serum is not corrected. So meaning baka nandito yung missing factor natin. So sa fresh serum, ang mga wala or mga absent na factors dun is si factor 1 less than 20% ng 2. So meaning meron pa rin konting factor 2. Okay? Tapos factor 5, factor 8 and factor 13. Okay. So hindi pwede or let's do cancellation muna. Okay? So again, nasa common pathway yung missing factor natin. So hindi pwedeng factor 8 yung missing kasi factor 8 is or factor 8 belongs to the intrinsic pathway. Hindi rin pwedeng si factor 13 yung missing natin because your factor 13 is not detected using the mixing studies. It has its own test. Ang test na ginagamit for factor 13 deficiency is the 5M urea solubility test. 5M urea solubility test, okay? Or Docker's test. Okay, so next, hindi naman pwedeng factor 2 kasi your factor 2 is present pa siya. 'Di ba? I mean, kung wala ang factor 2, edi sana, 'di ba? Edi sana yung adsorbed plasma not corrected din, 'di ba? So hindi factor 2. Hindi rin pwedeng factor 1 kasi your factor 1 is present. Kasi kung walang factor 1, edi sana abnormal or prolong yung thrombin time. So the best answer here is factor 5 kasi sa fresh serum, okay, factor 5, and kung titignan mo din sa age plasma, dalawa na lang sila natira, so hindi pwedeng factor 8, so factor 5. So our missing factor is factor 5. Okay, so for number 4, you do it yourself. Okay? So, try nyo namang i-identify. Kung gusto nyo i-try, ayan. So, don't forget, identify muna kung ano yung mga na-prolong, identify kung anong pathway sa coagulation cascade, then tignan kung corrected or not corrected ba. So, ayun, please comment down na lang your answers para ma-check natin, okay? So, thank you for listening. That's all for mixing studies. If you have questions, lagay na lang din sa comments. Thank you!